Hello guys, welcome to another episode of Cardiology series by AMC Study Hub. Today we are going to discuss about a short and sweet topic, mitral valve regurgitation. So, before telling about the regurgitation, let me tell you the mitral valve is located between the left atrium and left ventricle as we already discussed in some other condition. Mitral valve is located in between left atrium and left ventricle. This valve helps the blood to flow from left atrium to left ventricle normally. But in this condition, there is certain damage happened to the mitral valve. Hence, it does not close properly. So, what happens if it doesn't close properly? The blood which comes normally from left atrium to left ventricle will also go back from left ventricle to the left atrium, which is abnormal. So imagine once the blood is going into the left atrium continuously, left atrial pressure increases. We have already discussed about this phenomena. Once the left atrial pressure increases, blood will move out to the pulmonary vein, and from there blood will go into the lungs. Once it is in the lungs, what happens? Pulmonary congestion and pulmonary edema. So here I think it makes sense why I have written pulmonary edema here. And the next thing is, so this mitral valve regurgitation is asymptomatic mostly in most of the people. And most of the time it's found out when we do 2D echo for some other screening. So we can say this particular MR is also mostly diagnosed incidentally. It's an incidental diagnosis because most of the people are not severely affected by this condition because this backward flow of blood will be minimal in most of the case. So that very little amount of blood mixing up doesn't make big change or big signs and symptoms. So the severe MR, of course, severe MR will have severe manifestations also. Okay, and if it is a very mild MR, then we usually don't treat it. If it is very severe, we will have to go to some surgical correction. Okay, so now let's imagine if the patient is having severe MR, what happens? Of course, the patient will undergo left-sided heart failure. Let me explain the physiology of that. So, okay, normally we will be having venous return to left atrium. Normally, okay. This venous return is from the pulmonary circulations and all. We will be having a venous return. So this venous return is a normal part. So the left atrial venous return will go to left ventricle normally. From left ventricle where it goes? It goes to the arch of aorta. From the arch of aorta it's distributed to the systemic circulation. Okay, this is the normal thing. Now just imagine here the patient is having normal venous return plus mitral valve regurgitation. Hence, the blood that normally comes to the left ventricle will not be completely pushed up into the aorta. It will not be completely pushed up because a particular amount of blood during systole, when the left ventricle contracts, a particular amount of blood will be going back to the left atrium. Again, the venous return will come. Again it have a systole, left ventricle will have systole, the amount of blood will be going to the left atrium. So this particular part will be always overworking. So the continuous working of left ventricle and left atrium along with a lot of blood pooling in the left ventricle and left atrium, of course left-sided hypertrophy, fibrosis, all those things occurs and it dilates and fibrosis occurs and the patient will finally go into left-sided heart failure. So I think the concept of left-sided heart failure is clear from this. And See, this particular mitral valve regurgitation can also occur due to some other secondary causes. One such cause that I could explain you is due to inferior wall MI, inferior wall myocardial infarction. Due to right coronary artery occlusions, we can have inferior wall MI. So imagine we have the valve here. Okay, we have the mitral valve here. This mitral valve is connected to this particular thing. It is called papillary muscles. Okay, so if the patient have any occlusion in right coronary artery, the patient can have inferior wall MI. Inferior wall MI in the sense that particular area of the heart have undergone ischemia, or to be simple, that particular part of the heart have undergone death. So once it is dead, this papillary muscle is also dead. Right. This papillary muscle is having connection to this particular valve. This papillary muscle will help in the closing and opening of the valve during systole. So, as the papillary muscle is also damaged due to inferior wall MI, the patient will be having ischemic mitral valve regurgitation. This is actually not primary. It is caused by some other problem. Hence, it is called secondary myocardial. Sorry, I am getting always myocardial. It's secondary mitral valve regurgitation. As it is caused by inferior wall MI, we can say it as ischemic mitral valve regurgitation, which is secondary. Okay, so the diagnosis, as I told you, mitral valve regurgitation is mostly asymptomatic and it's mostly diagnosed incidentally. So the diagnosis is done by 2D RX. Moving on to the treatment, if it is severe, then we will have surgical correction. In severe cases of mitral valve regurgitation, of course, the patient does not have any other choice because the valve is damaged or the valve is not closing properly. In such cases, you don't have other management rather than making a mitral valve repair. It's actually a surgical correction. That's what I told. Surgery is the management of choice for mitral valve regurgitation. And if in case the patient is having mitral valve regurgitation caused by some functional issues, so that functional MR can be improved by biphasic or biventricular pacing. Okay, it's biventricular pacing. So that's it about mitral valve regurgitation. So one more thing that I would like to tell is, mostly in mitral valve regurgitation, the type of murmur that we could hear is pansystolic or holosystolic murmur. So in most of the cases in mitral valve regurgitation, you can hear pansystolic or holosystolic murmur. Okay, so that's it about mitral valve regurgitation. It's a very small topic. I hope I have covered the important aspects that can be asked in your competitive exams. So that's it. Thank you so much.